Hello everyone, we're going to go ahead and cover diseases and conditions of the respiratory system. So let's go on to the first slide. So orderly function of the respiratory system. Respiration is made possible by ventilation and healthy lung tissue perfused by blood. So one of the things you want to keep in mind is when we talk about respiration, we tend to think of the breathing process. That's actually ventilation. So I want to make sure I clarify what the difference is in respiration because we're going to use the terms internal and external respiration, and that is gas exchange. So that's exchange. So there is a difference in respiration and ventilation. So ventilation is the movement of air. Breathing is controlled by the central nervous system, and then we have a pulmonary circulation. Pulmonary arteries carry deoxygenated blood. Pulmonary capillaries are the area of gas exchange, so between oxygen and carbon dioxide. And then pulmonary veins return oxygenated blood to the heart. And then we have the lungs and the kidneys, which also help maintain pH balance. Next, we have external respiration. So when we're talking about external respiration, we're talking about the oxygen that is exchanged in the lungs. And this is at the alveolar level. So this should be familiar from either anatomy and physiology or from medical terminology. So we have internal and external respiration. External respiration, we have the oxygen that is brought into the lungs from when we inhale is exchanged. So it moves from the alveoli to the capillary, and the carbon dioxide goes from the capillary into the alveoli, which would then be exhaled. Now, internal respiration is the exchange of gases between the blood and tissue cells. So internal respiration is what's going on. This occurs everywhere else in the body. So this is at the capillary level. So external respiration occurs at the alveolar level in the lungs, and internal respiration occurs everywhere in the body. All right? Inhaled and exhaled air passes through the respiratory tract. Inspiration and expiration. The first would be inspiration, where the diaphragm contracts, and this causes air to be sucked into the lungs. So this is an active process. So when the diaphragm contracts, it changes the pressure, and air is pulled or sucked into the lungs, whereas expiration is the relaxation phase. So the diaphragm relaxes and forces air out of the lungs. And that inspiration and expiration would be the process of ventilating. You're bringing air in and out of the lungs, whereas internal and external respiration is gas exchange. All right, here are some of the structures. This should hopefully be familiar from MedTerm or A&P. So when we're talking about external respiration, this is the area we're talking about. So we have the alveolar level, and we have this capillary network around the alveoli. So this is the area of gas exchange. So we have the air, where we have the oxygen in the alveoli going into the blood vessel, and then the carbon dioxide from the vessel, the capillary, going into the alveoli. All right, this is just showing the process of inspiration and expiration. Here we have the diaphragm flattens, it's contracting down, it pulls down, which then sucks air into the lungs. Here we have expiration, where the diaphragm now relaxes and becomes dome-shaped again, and then the air is forced out. All right, so with inspiration, we know our chest cavity expands, and with expiration, it becomes smaller. All right, symptoms of respiratory disorders. That includes chest pain, dyspnea, hemoptysis, which is spitting up of blood, dysphonia, chills, low or high-grade fever, wheezing, and fatigue. Common cold, or coryza, can infect the nose and pharynx or larynx in various areas of the lungs. And there's several different types of cold viruses. So the book mentions the 200 different types of viruses. There's probably more. So a group of minor illnesses that can be caused by almost 200 different viruses. Common symptoms of coryza are the common colds, nasal congestion and discharge, sneezing, watery eyes, sore throat, hoarseness of the voice, and coughing. This is very different from the flu. So the common cold, you just feel kind of crummy for a few days, but you can function, whereas with the flu or influenza, you're usually in bed feeling horrible like a truck hit you. All right. An ordinary cold should clear up 4 to 5 days. Medications that help are antihistamines, which help dry up nasal secretions. Decongestants, what they do is they induce vasoconstriction of blood vessels in the nose and throat and sinuses. And then cough suppressants help reduce the amount of cough. Next we All right, so next we have sinusitis. So the frontal sinuses and the maxillary sinuses are the sinuses that are most commonly involved. Typically produces a headache, pain, drainage, and tenderness. Usually on the forehead and on the cheeks, there's a pressure and discomfort caused by virus, fungus, or bacterial infections. Treatment, there's a lot of controversy about treatment of sinusitis. Some say in adults, that even with antibiotics, without antibiotics, the sinusitis would generally clear up. A lot of science is now pointing to the saline irrigation to clear out the sinuses rather than using antibiotics first line. And so it's on both sides. Some people say, yes, you need a broad spectrum antibiotic. Others say, do the irrigation with the sinuses and see if it clears up. So a lot of different points of view. So there are saline and corticosteroid nasal sprays, broad spectrum antibiotics and decongestants, antihistamines, and oral corticosteroids. All right, and this is just showing you the sinuses here. So we have the frontal sinuses and the maxillary sinuses, and you can see here why there would be facial pain and forehead pain. And then we also have the ethmoid sinuses, but they're generally not as involved as the frontal and maxillary. All right, pharyngitis, so inflammation of the pharynx, involves inflammation of the tonsils, uvula, palate, and presents with a sore throat, dryness, burning sensation, or a sensation of something in the throat like a lump. Most common cause is a viral infection. So just because someone has a sore throat does not automatically mean that it's streptococcal infection or strep throat. So when we look at the throat, it's generally red with swollen mucous membranes, using like saltwater gargles, drinking lots of fluids, using throat lozenges and anti-inflammatory medications generally help, and it will go away in a couple of days. Nasopharyngeal carcinoma. So classic clinical triad of symptoms is neck mass, nasal obstruction with epistaxis or nosebleed, and serous media. So people in southern China areas, in southern China and areas around the Mediterranean Sea, Southeast Asia, and the Arctic are at risk. So surgery is usually not performed as treatment, so it's treated with radiation therapy with or without the chemotherapy or adjuvant chemotherapy. Laryngitis is inflammation of the larynx, which is the voice box. And so what generally happens is a hoarse voice, so the kind of raspy voice. Now, laryngitis can be from different things. It could be from an illness, but it can also be from overuse. So like yelling, screaming, and then also singers get it. So it could be viral, it could be bacterial, and then it can also just be from overuse. It can be chronic or acute. And it can be, they can do a laryngoscopic examination where they look down with a scope at the larynx and they can see mildly or highly inflamed mucosa. The treatment, voice rest, bed rest, liberal fluid intake, and use of cough syrups, because when they cough, it causes more inflammation. Deviated septum, this causes narrowing and obstruction of the air passage on one of the sides where it's deviated. So it may be of no consequence until aggravated by trauma to the nose. It can also be a congenital anomaly, which is usually the case, and treatment is not usually necessary unless it compromises the air passage. So if the person has trouble breathing out of that nostril. And the only possible prevention is avoiding trauma to the nose. And this is showing you the deviated septum, so this is definitely much more narrow than this side here. It's deviated to the side here. All right, nasal polyps. So polyps are usually caused by an overproduction of fluid in the cells of the mucous membrane. They can become very large and they can obstruct the airway, and they can also decrease the sense of smell. So what they do is they go in and they remove them surgically. That's a treatment of choice. But they can also be injected with steroids, and then there's not really anything to do to prevent them unless the person has like a really chronic allergic rhinitis, which could be the reason why they develop them, and then it would be controlling the allergies. And this is showing you nasal polyps. This is the clear nostril, and this is a polyp hanging through the nostril. So this would really occlude airflow. Anosmia is the ability to taste liquids and food also is impaired or lost. It's a chronic condition, and most common cause of anosmia is we have intranasal swelling accompanying an upper respiratory condition causes a temporary anosmia. So they lose the ability to taste liquids and food. Treatment is aimed at the cause. Polyps are removed. Allergic rhinitis is treated with a series of injections. Epistaxis or nosebleed. This usually occurs only in one nostril with no explanation. Nosebleeds that persist for more than 10 minutes after constant pressure require immediate care. There's different types of epistaxis, the level of hemorrhage. A common cause of epistaxis are colds and infections because they irritate the nasal mucosa. Little capillaries break or also larger vessels. Mild hemorrhage may be controlled with just applying constant direct pressure. And then, oops, sorry, I didn't mean to click that. And then a moderate hemorrhage may need pressure and maybe like an ice pack. And then a severe bleed may require an electric needle or cauterization, or the blood vessel may need to be tied off or sutured. Right? Tumors of the larynx. So benign or malignant growths on the larynx. What's going to occur is dysphonia. Is the most common symptom. And then there's two types of benign tumors. There's papillomas and there's polyps, and they're caused by misuse or overuse of the vocal cords. Then we have benign growths that are treated with correction of with vocal strain, and then also reflux management. So if someone has gastric reflux, they have acid rolling up, and it can injure the larynx, okay? So malignant tumors may often be treated and cured with radiation if they're discovered early. And one of the things they're finding now with head and neck cancers is the association with HPV or human papillomavirus. So the actor Michael Douglas, he had cancer of the larynx, and it was traced back to HPV. So here we have normal larynx and true vocal cords, and over here we have a polyp on the left vocal cord. All right, laryngeal cancers. Persistent hoarseness tends to occur early in the disease process and is the most common symptom. And then other symptoms may occur. So it's such things as dysphagia, hemoptysis, chronic cough, referred pain to the ear, and stridor. And then major risk factors for development of laryngeal cancer are smoking and alcohol abuse, and the quality of life issues are often incorporated into a treatment plan. So, depending on, how's their life going to be with or without treatment. Hemoptysis is sputum streaked or spotted with blood and can be present with minor infections. It can be from injury. It can be also an indication of a carcinoma. So we have profuse bleeding is present in severe lung infections. Trauma, erosion of a vessel, calcification, or tumors can cause bronchial bleeding, as can inflammatory conditions. And the source of bleeding is treated once located. So whenever somebody has hemoptysis, we need to find out where is the source. So it might be ligation or surgical removal, or repair of the involved vessels is indicated if there's severe bleeding. Atelectasis. So this follows incomplete expansion of lobules or segments of the lung. So our lungs are never empty. So when we exhale, all of the air does not leave the lungs. There's always some air, and the alveoli or the lungs are never fully empty. There's always some air in there. So what happens with atelectasis is that there's incomplete expansion and of the segment of the lung with partial or complete collapse. So now the alveoli collapse there, and then they don't refill. So dyspnea is another symptom. It's caused by an obstruction in the bronchial tree. Compression atelectasis results when a tumor exerts pressure on the lung and does not allow air to enter. So treatment, we've got antibiotics, analgesics, surgical drainage of the pleural effusion for treatment. So basically the treatment of atelectasis depends on the cause. So here we have atelectasis. We have the normal lung, and then we have over here the collapsed lung. And so this would be, there's a pleural effusion as well. And then over here we have an external mass, which causes the compression atelectasis. And then we have the obstruction in the bronchi, which causes atelectasis here, obstructive atelectasis. All right, pulmonary embolism. Size and location of the embolism and general physical condition of the patient determine consequences of interruption of blood supply. So there's different levels of pulmonary embolism, depends on the size and how much of the lung is affected. So most common symptom is sudden onset of dyspnea and chest pain. So the emboli may also be composed of fat, air, globules, a small piece of tissue, or a cluster of bacteria. Or it could, be a blood clot. So we have lung scans and CT angiography of the chest are used to image the pulmonary blood flow. So we want to see where did the embolism lodge in the lungs, so we know where the blood flow has stopped. Echocardiogram is also used to assess pulmonary artery pressure and right heart function, because remember, the right side of the heart is pumping blood to the lungs. So now if there's some kind of backup there, we've got to assess the pressure on the right side of the heart. There's not blood, there may not be as much blood actually going into the left side of the heart. All right, primary treatment is aimed at preventing a potentially fatal episode and maintaining cardiopulmonary integrity and adequate ventilation and perfusion. So this is showing you here's an embolism. Remember, an embolism and a thrombus. So thrombus forms in the area, and an embolism is a thrombus that is broken off from somewhere else and now is lodged somewhere. So as you can see, if the emboli is here, it's traveling up, gets lodged here. Now all of this area is lacking blood supply, so it's the infarcted area. Pneumonia. So a lot of time people think pneumonia means that there's fluid on the lung. It actually means inflammation. So inflammation may be either unilateral, so one-sided, or bilateral, which is both sides, and involve all or only a portion of the infected lung. So there's different types of pneumonia. It doesn't always have to be from bacteria or virus. It could also be from aspiration. So aspirating something into the lungs. So that could be from liquid or material into the tracheobronchial tree. And generally it's caused by virus or bacterial infections. There's also chemical pneumonias where someone inhales a chemical and it causes inflammation and a potentially fluid accumulation in the lung. Treatment options for pneumonia, it's going to depend on the cause. So organism-specific antibiotics are prescribed if it's a bacterial pneumonia. Penicillin is the drug of choice for pneumococcal pneumonia. Mycoplasma infections may be treated with broad-spectrum antibiotics. If it's a fungal infection, it requires the use of various antifungal medications. And then viral infections are treated with specific antiviral agents. And this is just showing you. Now, when we look at a lung here, we should see lots of dark. And over here, what you can see is this white, cloudy area, and that should not be there. The lung should be air-filled. We shouldn't see fluid and inflammation. All right, health hazards of common molds. So you've probably heard of toxic molds, black molds. So this is inside homes, and it can cause allergic symptoms and some serious health conditions. So what happens when they find these toxic molds is they basically shut down the house. These crews come in, and these looks like they're space outfits. They have to clean it all out. And so the CDC information, molds grow naturally in both indoor and outdoor environments. Mold exposure does not always present a health problem. In most cases, mold can be removed by thorough cleaning with commercial products, and all molds should be treated the same. Pulmonary abscess. So main symptoms are alternating chills and fever. So remember, an abscess is an abscess. We call it based on where it is. So if it's in the lungs, we call it a pulmonary abscess. So we have an accumulation of pus. It's caused by complication of pneumonia from bacteria, aspiration of food, a foreign object, bronchial stenosis, or neoplasms. And it can also be caused by a septic embolism, which is carried to the lung via pulmonary circulation. The treatment of the abscess is the use of antibiotics for a fairly long duration. And this is just showing you here. Here's the abscess with the pus formation. And if they're really severe, they're going to go in and actually drain that. And then, of course, treat with antibiotics as well. All right, legionellosis or Legionnaire's disease and Pontiac fever. Pontiac fever is the less severe form of Legionnaire's disease. So it's Legionnaire's disease is severe, produces severe pneumonia-like symptoms. Pontiac fever includes a high fever and muscle aches. Both disorders are caused by the Legionellosis pneumophila. Antibiotic therapy is initiated before a diagnosis is made, and Pontiac fever usually resolves on its own. And so this has a really interesting history. They talk about it in your book about Legionnaires and why it's called Legionnaires, because it's actually Legionnaires' Convention when it was several people came down ill and people died from this infection. RSV, or respiratory syncytial virus pneumonia. This causes cold-like symptoms, including nasal congestion, otitis media, and coughing. This is really dangerous for premature infants. So if an infant is born premature, we get very concerned about RSV because it could actually kill them. RSV is a causative agent for RSV pneumonia. Greatest occurrence in these annual epidemic infections are during the winter months. Antipyretics are prescribed for fever. Antibiotics are given for otitis media. And then inhalation of a 3% hypertonic saline is used to treat RSV. So because it is a virus, antibiotics are not going to help with it. Antibiotics would only be given if they develop a bacterial ear infection. Histoplasmosis. Many patients with histoplasmosis are asymptomatic at onset. So this is a fungal disease. So as the fungus starts to disseminate in the lungs, the patient reports dyspnea, loss of energy to the point of incapacitation. Histoplasmosis is caused by the fungus Histoplasmosis capsulatum, which is carried by dust, and it's inhaled. Antifungal drugs, the etranacol, fluconazole, and amphotericin B are used to treat more severe or progressive disease. Influenza, or the flu. So there's different types of flu viruses. There's also para-influenza viruses. And the best way to reduce your risk of getting the flu is to get a flu vaccine. So this is an annual vaccination, and there's a lot of controversy again about influenza vaccines. Some people swear by them, some people don't get them because they don't think they help. One good thing about getting the vaccine, well, there's a downside because if it's not the right vaccine, then you can still get sick. It doesn't protect against all flu viruses, but one thing that it does is there are some viruses that it does protect against when you do get vaccinated. So maybe not just the target flu, but some of the other flu viruses as well. You may have protection if you get a flu shot. All right, so transmission is from person to person by inhalation of the virus and airborne mucus discharge. And the virus that causes influenza are designated by the orthopnovirus, orthopnoxavirus types A, B, and C. So, acute uncomplicated influenza with recovery is the most frequently encountered. Now, keep in mind, 100 years ago or more, people died from influenza. There was, when the flu went around, hundreds, sometimes thousands of people died. If you look up the Spanish flu, and in the early 1900s, millions of people died of influenza. So influenza outbreaks may be sporadic or epidemic. Transmission is from person to person by inhalation of the virus. Bed rest, increased fluid intake, a light diet, use of antipyretic and analgesic drugs are helpful. Again, antibiotics are not going to help because this is a virus. H1N1 or swine flu is a novel influenza A virus. It's highly unusual mix of swine, bird, and human flu viruses. It's contagious and it's spread human to human, can range from mild to severe, and symptoms of H1N1 in people are similar to symptoms in regular human flu. And it is susceptible to Tamiflu, just like other flu viruses, and also the Relenza. So those are antiviral, anti-flu medications. Chronic obstructive pulmonary disease, or COPD, this is a condition of slow, irreversible, progressive airway obstruction. And so what we include in the COPD is chronic bronchitis, bronchiectasis, asthma, emphysema, cystic fibrosis, and pneumoconiosis. So acute and chronic bronchitis, we determine that by the duration. So acute is usually a quick onset, deep, persistent, productive cough is the main symptom. Chronic inflammation persists and becomes worse for at least 3 months of of the year for 2 years. So that's the determination of chronic bronchitis. Inflammation persists and becomes worse for at least 3 months of the year for 2 years. Okay, so acute bronchitis is part of a general upper respiratory infection and begins after a common cold or other viral infection. The same bacteria known to cause pneumonia may be responsible for chronic bronchitis. Treatment of bronchitis depends if it's bacterial, viral. So if it's acute bronchitis, it's usually viral. There's no specific treatment. It's self-limiting, just supportive measures, rest, fluids. And then treatment of chronic bronchitis is based on the stage of the disease. So oxygen therapy may be administered, and then postural drainage and percussion are techniques used to help loosen and expectorate thick mucus. Bronchiectasis, this is permanent irreversible dilation and distortion of one or more bronchi, resulting from destruction of muscular and elastic portions of the bronchial walls. So it basically loses that recoil. So the bronchioles and the alveoli, everything expands and then bounces back. And with bronchiectasis, it's the loss of that elastic portion of the wall. Pulmonary emphysema is a chronic obstructive pulmonary disorder where there's destructive changes in the alveolar walls and irreversible enlargement of the alveolar air spaces. So what that means is the alveoli now become very dilated and they're not expanding and then bouncing back. So you're not going to get good gas exchange at that level. So people with emphysema, even though they're moving air in, that because they don't get good gas exchange, they're constantly gasping for air. They tend to have pursed lips. They're called pink puffers and they're usually very thin because they use so much energy just trying to breathe. All right, bronchiectasis, usually bilateral and involves the lower lobes of the lung. The person will have a chronic cough producing large quantities of sputum, and there may be caused by repeated damage to the bronchial wall from airway infections. Antibiotics and bronchodilators are prescribed, and postural drainage is also encouraged. This is showing you bronchiectasis. You can see all these dilated areas, and there's mucus, so this is not a healthy lung. And then continuing with pulmonary emphysema, there's the gas exchange, as I mentioned before, with the enlarged alveoli. So even though they're bringing air in, the gas exchange, the oxygen is not moving the way it should. So most of the time, people with emphysema have a history of cigarette smoking, and that tends to be the most common factor. Drug therapy, beta-2 adrenergic sympathetic drugs alone in combination with corticosteroids. And here you can see with emphysema, see the person is very, very thin because they spend so much energy just trying to breathe. And they have these pursed lips and they kind of have this leaning forward, kind of gasping for air. And you'll see these people with the nasal cannula and the oxygen tank that they carry with them. All right, pneumoconiosis refers to a number of occupational diseases. So it's progressive chronic inflammation, fibrosis, and infection of the lungs. So they're occupational, and what that means is they're caused by the job. So in this, we have several different types of diseases and disorders. So the onset symptoms can be insidious, with dyspnea on exertion being the first symptom. Usually takes at least 10 years of continual daily exposure to develop. And so one of the pneumoconiosis is the anthracosis, which is also known as black lung or coal miner's lung. And there's different types. This is probably the most popular, the one that people know the most about. But there's also, besides black lung, there's brown lung. And so there's other types of occupational lung diseases. You've probably also heard of mesothelioma or asbestosis, and so that's another occupational disease that affects the lungs. All right, so this is showing black lung. You can see this should be pinkish white, and you can see the coal deposits, not tar deposits. Tar deposits would be from a smoker, but the coal deposits are from the black lung. All right, here we have silicosis. This affects workers who are stonemasons or metal grinders or who work in queries. So the treatment is directed towards relieving symptoms, and that includes bronchodilators, oxygen therapy, chest physical therapy to help remove secretions, and corticosteroid drugs for short term. All right, next we have pleurisy. And pleurisy or pleuritis, either one is fine. You can use either term. They mean the same thing. What happens is the pleural membranes, there's wet and dry. There's different types of pleurisy. But the patient will present with very sharp needle-like pain when they breathe or cough. It's very, very uncomfortable. They may also have fever, chills, and shallow breathing. So just imagine the pleural membranes that surround the lungs. The double membrane gets inflamed. So it's usually secondary to another disease or infection. And like I mentioned before, there's wet, where there's inflammation and there's still fluid, and then there's dry pleurisy, where the pleural fluid between the two membranes decreases and the membranes rub together. So antibiotic therapy and analgesics to control the pain may be given. And then here we have, you can see the pleural fluid here, or exudate. We have the parietal pleura, and then the visceral pleura. Visceral pleura, again, is on the organ side. So this area, if it's inflamed, every time this person takes a breath, it's going to be very painful. Pneumothorax. So this first symptoms we have are severe shortness of breath, sudden sharp chest pain, and falling blood pressure, rapid weak pulse. So pneumothorax can be spontaneous, which means it just occurs, or it could be traumatic. So a spontaneous pneumothorax occurs when an opening is present on the surface of the lung. And so that what happens is the lung just kind of pops or opens. This is more common in white males who are tall. So tall white males tend to be more the person when there's a spontaneous pneumothorax that we would see that. That would be your typical patient. Traumatic pneumothorax occurs when the integrity of the pleural cavity is breached. So let's say a stab wound or a gunshot wound or impaling. So now there's an opening that breaks through the chest and allows air in. So treatment of a pneumothorax, what we have to do is get that air out of the chest cavity. So they're going to use a suction. So the patient is also going to be more comfortable in a Fowler's position or semi-Fowler's, which means they're sitting up, and may require oxygen. And then they're going to put the occlusive dressing over the area and then use a chest tube to suck the air out. And a thoracostomy is performed to withdraw air from the cavity, like I mentioned before. So that would be the medical term, the thoracostomy. So here we have air in the pleural cavity. We do not want air around the lung, we want air in the lung. So here's a normal lung, and here's a pneumothorax. So pneumo, here we have air in this area. And then with a hemothorax, hemo meaning blood, there's blood in this space in the pleural cavity. There's also a term we call hemopneumothorax, and that is blood and air in there. So with the hemothorax, that's generally something you'd see with a stab wound, gunshot wound, or some kind of trauma. Hemopneumothorax as well. So with the hemothorax, signs of hemorrhage include pale, clammy skin, weak, thready pulse, and falling blood pressure. So the blood enters the pleural space, as you saw in the picture, causes the lung to collapse. Treatment, the lung has to be re-expanded, usually with the thoracostomy, with closed drainage to evacuate the blood. And the prognosis for a hemothorax is guarded. All right. Flail chest. This is the patient with flail chest experiences severe pain, dyspnea, and they're cyanotic. And of course, cyanotic means they're blue and extremely anxious. This comes from direct trauma to the chest wall. And how we define flail chest is there's a fracture of 3 or more adjacent ribs. And adjacent ribs means they're next to each other is the cause of flail chest. So the first responder emergency care employs measures to stabilize the chest wall until surgical repair is possible. So flail chest is usually, we'll see it in car accidents where someone's chest hits the steering wheel or someone falls and hits their chest. So the chest wall injury that fractures 3 or more adjacent ribs is what causes flail chest. So here you can see multiple rib fractures. So we have 3 adjacent. So it wouldn't be flail chest if we had one up here, one over here, one down here. What defines it is there's 3 adjacent, 3 or more. And what's going to happen when this person breathes is this is very unstable. So that would be flail chest, and it would have to be surgically repaired. All right, pulmonary tuberculosis or TB. So unfortunately, TB is making a comeback. It's caused by the tubercle bacillus mycobacteria tuberculosis. It's acquired by inhaling a dry droplet nucleus that contains the tubercle bacillus. And primary tuberculosis, the patient's asymptomatic. So that's the scary thing. Someone could have tuberculosis, they don't know. So as the body's defense mechanisms respond to the bacterial invasion, antigens are produced, which cause necrosis, followed by fibrosis and calcification in the tissue. So treatment is dependent upon whether the TB is latent or active. So you can see here, this is not normal lung tissue here. This is not normal. And tuberculosis can affect other areas. It can affect the skin and other organs. It just primarily affects the lungs. All right, infectious mononucleosis is caused by the Epstein-Barr virus. So that's what causes the infection. Symptoms of Epstein-Barr virus infection or infectious mononucleosis, or the term we call mono, is lymphadenopathy, so swollen lymph glands, fever that typically peaks in the afternoon, listlessness, malaise, chills, anorexia, sore throat, fever, headache, fatigue, cervical, and generalized lymphadenopathy. So mononucleosis we know caused by Epstein-Barr virus, which is a herpes virus. There's tons of different types of herpes viruses. And then acute treatment, forced bed rest, and fluid intake. The liver and spleen may be enlarged, so even when someone recovers from infectious mononucleosis, we're going to want them to avoid contact sports for about 6 months because we don't want their spleen to rupture or them to injure their liver. So this is showing you here, you can see the throat. So you can see the tonsils and the pharynx are very, very enlarged and covered with this kind of white exudate. And this, of course, also produces kind of a bad odor. So people with mono have bad breath odor. Adult respiratory distress syndrome, or ARDS. Symptoms: sudden severe dyspnea with rapid, shallow respirations, inspiratory, intercostal, and suprasternal retraction. So what that means is when the person breathes, when they inhale, the intercostal spaces, the spaces between the ribs, suck in. And this is very, very bad. That's a very bad sign, when we see that. So when the intercostal and suprasternal, so above the sternum, when there's retractions along with cyanosis and mottled skin, that would be very grave. So rales, rhonchi, and wheezes may also be present. It's considered secondary to some agent that precipitates increased capillary permeability of the lungs, pulmonary edema, and respiratory failure. And sometimes what will happen is someone with ARDS, they'll start coughing up and they'll foam up blood. They'll have a frothy blood coming out when they cough or breathe. So the alveoli fill within 12 to 48 hours of injury and then tend to collapse at the end of expiration. So you can see without treatment, this person would die. So this leaves less pulmonary tissue for gas exchange. So what this is saying is their lungs are now, the alveoli are now filling with fluid. And then the alveoli collapse after they exhale and do not refill. So low pulmonary compliance, pulmonary hypertension, decreased functional residual capacity, and hypoxemia result. The patient needs to receive supportive care, and efforts are made to correct the underlying cause of ARDS. But without treatment, they could die, or they would die. Sarcoidosis. So this is a kind of interesting type of disease. It also goes under autoimmune disorders. So patients may have no complaints or mild to severe symptoms depending on the site of the lesions. The reason it's in this chapter is because sometimes the lesions will be found in the lungs. The exact cause of sarcoidosis, or the etiology, is not known. It's not certain. It's thought to be a malfunction of the immune system or caused by a virus. So that's why it's often put as an autoimmune disorder disorder or disease. It can flare up and then just go away all on its own. Corticosteroid therapy, such as prednisone, helps relieve some of the severe symptoms. Lung cancer, the leading cause of cancer death worldwide in both men and women, with 30% of all cancer deaths. And what do we think is probably the reason for lung cancer? Most common is smoking. So, most common symptom is a cough with or without sputum production. Other symptoms may include dyspnea, hemoptysis, chest pain, and weight loss. The two main types by histology are non-small cell lung cancer and small cell lung cancer. And the primary risk factor, as I mentioned before, is cigarette smoking. So completely preventable. This is showing you some lung carcinomas. This is not normal here. So this is showing this is a smoker. I can tell that. And then here's their carcinoma. And then I can tell this is also a smoker here because you can see the little tar residue from smoking. So diagnosis and treatment of lung cancer. Many patients are symptomatic at the time of diagnosis. Some may be diagnosed following a chest radiograph. Not all patients are symptomatic though. Sometimes lung cancer is found just because they're looking for something else. So I have a friend who fell and they thought she broke her clavicle. So they did an x-ray and they found a lung mass. And so it was completely accidental that they found it. She wasn't a smoker, no family history. It was just a weird fluke. And they found it because she actually injured herself. So testing is also done to look for specific biomarkers that may affect treatment choice, such as gene mutations in the epidermal growth factor receptors or anaplastic lymphoma kinase. Treatment decisions are based on the type of tumor and the stage of the tumor. Prognosis and prevention of lung cancer. Prognosis is generally poor, and the reason is when it's diagnosed, it's usually advanced. So it's not one of those things that they find when it's really small and contained. It's generally by the time they're symptomatic, it's not good. The stage is advanced. So 5-year survival rate for all stages and types of lung cancer combined is only 15%. And prevention, stop smoking, avoidance of exposure to secondhand smoke. And also lung cancer can be caused by exposure to other chemical inhalation as well. All right, that is it for Chapter 9, Diseases and Conditions of the Respiratory System, and I hope that was helpful.